Namaskar, my dear students. Today in the dental materials section, we will be discussing dental amalgam. I have got many requests for this topic, so I am taking this topic now. Though it is a less widely used restorative material in clinics, but theoretically and academically, it is still the gold standard. I will try to cover each and every aspect of this topic. So let's get started. Now we all know that dental caries is a bacterial disease of the calcified tissue of the teeth, which leads to the demineralization and destruction of the hard tissue, which leads to the cavity formation. In this, if we talk in a layman term, a filling is required. That means a restorative material is required which needs to be filled in the cavity that has been formed. And this restorative material can be the direct restorative material. That means the material is directly filled in the cavity, in the tooth, in the mouth, and indirect restorative where the restoration is prepared in the lab and then it is cemented or luted on the tooth. In the direct restorative materials, we have dental amalgam, dental composites, glass ionomer cements. Okay, and in the indirect, we have inlays, onlays, crowns, which are prepared from the different alloys. Now in this video, we will be discussing about the dental amalgam, that is the direct restorative material, in detail. Let us know these terms first of all. What is amalgam? Amalgam is an alloy which contains mercury as the major ingredient. Now coming to the dentistry, first of all, what is dental amalgam alloy? Okay, this alloy is a silver tin alloy to which the varying amounts of copper and small amount of zinc has been added to get the desirable property. When this dental amalgam alloy is mixed with the liquid mercury, okay, it forms a set mass that is called as dental amalgam. So dental amalgam will be the alloy of the mercury with the silver tin alloy. Now, if we specifically talk about the dental amalgam alloy, the amalgam alloy, it contains predominantly silver and the tin as we just discussed. These are the main elements. Apart from this, unspecified amounts of other elements like the copper, zinc, gold and mercury, these are added. These are added in less concentration as compared to the silver or the tin. These are mainly added to obtain the desirable properties of dental amalgam alloy. Next, we come to the classification of the dental amalgam alloy. These can be classified on 6 bases. This is very important, often asked in theory exam and also in the viva. So the first classification is based on the number of alloyed materials. Second is based on the copper content in the alloy. Third, based on the zinc content in the alloy. Fourth, based on the powder particle size. Okay, next is the based on the composition, what all is present, it is a mixture or it is a unique composition. Then next is based on the shape of the powdered particles. Now we will discuss them one by one. The first classification is based on the number of alloyed materials, mainly the metals. In this first we have the binary alloys. Their binary means 2. So 2 alloyed metals will be present. Example is silver, tin. Second is the ternary alloys. Ternary means 3. When 3 alloyed metals are present, example is silver, tin, copper. And next is the quaternary alloy. Quaternary means 4. When there are 4 alloyed metals, example is silver, tin, copper, India. The second classification is based on the copper content of the amalgam alloys. The copper content can be low copper alloys and high copper alloys. In the low copper, it contains less than 6% of the copper. These are the conventional alloys. The high copper, which are more popularly used now, they contain the copper from 13 to 30%. The high copper alloys, they can be further classified as admixed, dispersion or blended alloys. Right from the name itself, that means it is a mixture. And second are the single composition or the unique composition alloys. Next, the dental amalgam alloys, they can be classified based on the zinc content. Based on the zinc content, they can be zinc containing alloys in which they contain more than 0.01% of zinc, and second are the zinc free alloys. That is less than 0.01% of zinc is present. Now, why zinc free alloys? You know, zinc, it causes delayed expansion. We will be discussing about this in detail. So the zinc free alloys, they do not show this type of delayed expansion when they are contaminated with water. But the zinc free alloys, they are less plastic and less workable. Next classification is based on the powder particle size. The average particle size of the modern powders of the dental amalgam, it ranges between 15 micrometer and 35 micrometer. Okay, now they can be classified as micro cut where the alloy particle is less than 10 microns. Second is the fine cut, and third is the coarse cut alloy particles. The next classification is based on the composition. Based on the composition, they can be admixed alloy powder. Admixed alloy powder, it is formed by mixing one part of silver copper eutectic alloy, okay, which contains high copper spherical particles, with two parts of silver tin alloy, that is the low copper lathe cut particles. Okay, now the second is the unicomposition, or it is also called a single composition. Why? Because in this, the each particle of the alloy powder, it has the same composition. The next classification is based on the shape of the powder particles. The shape of the alloy particles can be lathe cut alloys or irregular shape. Second are the spherical alloys where the particles are spherical, and third is the admixed alloy, which is a mixture of the two. Now let us quickly compare the spherical and the lathe cut alloys. As I told that the particles of the lathe cut, they are irregular, and particles of the spherical alloys, they are spherical. The lathe cut alloys, they are manufactured by milling of the annealed ingot of the alloy, while the spherical alloys, they are prepared by atomization of the molten alloy. Okay, the very important point, lathe cut alloys, they are less plastic, while the spherical alloys, they are more plastic. Okay, so that is why they need a matrix to form the walls, proximal walls. The lathe cut alloys, they require more mercury. Okay, so that is why they have inferior properties, while the spherical alloys, they require less mercury and they have improved property. Okay, so these things are often asked in the Viva. Let us discuss the composition of the dental amalgam alloy. If we look at this table, it shows the composition of the commercially available low and the high copper amalgam alloys. In the low copper, the particle shape is lathe cut or spherical. The silver which is present is 63 to 70% and tin 26 to 28%. As they are low copper, so the copper content will be less, 2 to 5%, zinc 0 to 2%. In the high copper, we have admixed and the unicompositional. Admixed contain both the lathe cut and the spherical particles. The silver is around 40 to 70%, then tin 26 to 30 or 0 to 30. Copper content is high as it is a high copper alloy. Okay, next is the unicompositional or the single compositional alloy, which mainly contains the spherical particles. The silver is 40 to 60%, the tin is 22 to 30%, and the copper is 13 to 30%. Now let us discuss the function of these each constituents. Okay, functions of each constituent of the dental amalgam alloy. First is the silver. Silver is the major element in the reaction. It whitens the alloy, it decreases the creep, it also increases the strength of the alloy, it increases the expansion on setting, and very important, it increases the tarnish resistance in the resulting amalgam. Second is the tin. Tin, the content has to be controlled. Why? Because the tin, it controls the reaction between the silver and the mercury. If there will be no tin, what will happen? The reaction will be very fast and the setting expansion will be huge, unacceptable. Second, it reduces the strength and hardness of the resulting amalgam. It also reduces the resistance to the tarnish and corrosion. That is why I said that tin content has to be controlled. Third is the zinc. Zinc acts as a scavenger or a deoxidizer. It prevents the oxidation of silver, copper or tin which is present in the alloy. Second, if the alloys are formed without zinc, they will be more brittle and the amalgam which will be formed will be less plastic. Okay, zinc also causes delayed expansion. Delayed expansion is mainly caused when the amalgam mix is contaminated with moisture during the manipulation. It results in huge expansion. That is why we go for zinc-free alloys where we cannot control the moisture. Next is the copper. Copper, it increases the hardness and the strength. Okay, and it also increases the setting expansion. It also reduces the tarnish and corrosion resistance. Okay, next is the other constituents like the mercury, platinum and the palladium. Mercury, in some brands you will see, in some amalgam, it is present as a pre-amalgamated alloy. Okay, in this the mercury content is up to 3%, not more than that. What is the benefit of this pre-amalgamation? It produces a more rapid reaction. Okay, second is the platinum. It hardens the alloy and it increases the resistance to corrosion. And third is the palladium. It also hardens and whitens the alloy. Amalgamation reactions. Now let us discuss the setting reactions of different types of amalgam. Before going for the setting reaction, let us discuss the metallurgical phases in the dental amalgam. These are very important for the amalgam reactions and their symbols are also very important. Okay, so first is the gamma phase. Gamma phase is the silver tin compound. It is the unreacted alloy powder. Okay, second is the gamma 1 phase, which is silver mercury compound. Okay, Ag2Hg3 when it has been mixed. Okay, next is the gamma 2 phase, which is tin mercury, SN8Hg. The gamma 2 phase is the weakest component and it is least stable to corrosion. This is often the viva question and it is asked in MCQs also. Next is the epsilon, which is Cu3SN, copper tin. Next is the eta phase, that is Cu6SN5, again copper tin. And last is the silver copper eutectic alloy. First are the low copper alloys. The setting reaction of the low copper alloys, when the powder, that is the gamma phase, silver tin, it is triturated, it is mixed with the mercury. What will happen? The silver and the tin particles in the outer portion of the alloy will dissolve into the mercury. We can see in the picture the blue part, it shows the mercury and the orange are the alloy particles. So the silver and tin will come in the mercury, they will dissolve in the mercury and the mercury will also diffuse into the alloy particles. So when it reacts with the mercury, it forms the silver mercury compound, that is the gamma 1. It will precipitate out. Okay, we can see the white precipitates in the picture. This is the gamma 1 phase, that is silver mercury. Then the tin mercury, that is SN8Hg, that is the gamma 2 phase. It will also precipitate later. Okay, now as the remaining mercury, it will dissolve in the alloy particles. Both the gamma 1 and the gamma 2 crystals grow. Okay, now as the mercury disappears, that means the mercury is finished, the amalgam will harden as a set mass and the unreacted particles, they will be covered with the newly formed crystals, mostly gamma 1 and gamma 2 also. Okay, now if we look at the microstructure of the set amalgam, it is a typical low copper amalgam. It is a composite in which the unconsumed alloy particles, they are embedded in the gamma 1 and the gamma 2 phases. Let us just summarize the setting reaction of the low copper amalgams. In this, when the alloy particles, that is the silver tin compound, it is mixed with the mercury, it will form gamma 1 phase, that is silver mercury, and the gamma 2 phase, that is the tin mercury. Okay, plus the unconsumed alloy particles. So the matrix will be formed by the gamma 1 and the gamma 2 phases covering the unconsumed alloy particles. If we talk about the physical properties, the gamma phase is the strongest and the gamma 2 phase is the weakest. Okay, the hardness of gamma is more than the gamma 1, which is far greater than the gamma 2. As we said that gamma 2 is the weakest phase, and gamma 2, it also has very poor corrosion resistance. Now let us discuss the setting reaction of the admixed high copper alloys. What is present in the admixed alloy? Two alloys are present. First is the gamma, that is the silver tin, and second is the silver copper, that is the eutectic alloy. Okay, now when this alloy is mixed with mercury, then what will happen? The mercury, it will dissolve the outer portion of the particles. So silver from the silver copper eutectic alloys, then silver and tin from the silver tin alloy, they will enter the mercury and the tin will dissolve in the mercury. It will react with the copper of the silver copper particles and it will form a new phase, that is the eta phase, Cu6SN5 around the silver copper alloy. Okay, so it will form around the unreacted silver copper particle. As we can see in the picture, the black, it is surrounding the silver copper alloy. At the same time, simultaneously gamma 1 phase will be formed. Okay, what is the gamma 1 phase? The silver mercury. Okay, that will also precipitate. Okay, now the gamma 2 phase which was present in the low copper, it will be also formed, but it will be replaced by the eta phase. Okay, so now what we are saying, that in the admixed alloy, the undesirable gamma 2 phase is greatly reduced. Now if we just summarize the reaction in a simplified manner, the silver tin, that is the gamma phase, plus the silver copper eutectic alloy, when it is mixed with the mercury, it is forming gamma 1, that is the silver mercury, plus the eta phase, that is the copper tin phase, plus the silver tin which is unreacted and the silver copper which is unreacted. Now just look at this picture, the microstructure of the set high copper admixed amalgam alloy. The core particles, they mainly contain the unreacted gamma phase, that is the silver tin phase. It also contains the unreacted silver copper phase, which is surrounded by a halo of copper tin, that is the eta phase. Okay, then it is embedded in the matrix. We can see the matrix that is formed by the gamma 1, which is silver mercury. Next, coming to the single composition alloy. In this, each particle of the alloy has the same chemical composition. Okay, each particle, the major components are silver, copper, and the tin. 60% weight silver, 27% weight tin, and 13% weight copper. Okay, in this each particle it contains all the three phases, that is gamma phase Ag3SN, beta AgSN, and the epsilon copper 10. Okay, when these alloy particles are triturated with the mercury, then what happens? The particle, they dissolve in the mercury and they form the gamma 1 phase, that is Ag2Hg3. Okay, silver mercury crystal matrix is formed. Okay, now at this stage copper does not dissolve. After some time a layer of eta phase is formed, that is copper 10 Cu6SN5. Okay, then this forms the matrix. Okay, now if we see the overall simplified reaction, the alloy particles, when they react with the mercury, they will form the gamma phase and the eta phase. with unconsumed alloy particles. Okay, and if we see the now the thing that has to be noted is that little or no gamma 2 phase is formed in the single composition alloys. Okay, that is the undesirable phase which is not formed. Now coming to the microstructure of the set single composition amalgam. Now there are unreacted alloy particles, that is the gamma phase, which is represented by P in the picture. Okay, now these are surrounded by a mesh of rod-shaped eta phase, that is Cu6SN5, and embedded in the matrix made up of the gamma 1 phase, that is Ag2Hg3. Properties of the dental amalgam. We will discuss these properties one by one. First is the dimensional change. Second is the strength. Third is the creep. And fourth is the corrosion. The first and the very important property is the dimensional change. According to the ADA specification number 1, it requires that amalgam should neither contract nor expand more than 20 micrometer per centimeter between 5 minutes and 24 hours after the beginning of trituration. Now, this is the requirement of the dental amalgam. Now, amalgam, they can expand also and they can contract also depending on its manipulation. Though the earlier amalgams, they used to exhibit more expansion because of the greater mercury alloy ratio. We will come to that also. But first let us understand that if this contraction or expansion is taking place, what will happen? So the excessive contraction of the dental amalgam, it can lead to micro leakage. There will be a gap between the restoration and the tooth margin, so it will lead to micro leakage. It will lead to plaque accumulation and it will lead to secondary caries. Okay, now coming to the expansion, if there is excessive expansion of the dental amalgam, it will lead to pressure on the pulp, towards the floor of the cavity, post-operative sensitivity. Then it will lead to the protrusion of the restoration from the cavity. The patient will feel a high point there. If we talk about the current amalgams, they have the dimensional changes that are usually negative. Now let us understand how this contraction and expansion takes place. There is an initial contraction of the dental amalgam for the first 20 minutes, followed by after which there is an expansion, although the net change remains negative. Okay, now what is the cause of contraction? That initial contraction is taking place because the volume of the gamma 1, which is a product, is less than the mercury and the gamma, that is the dental amalgam alloy, which is mixed. Okay, so that is why the initial contraction is taking place. Afterwards, why the expansion is taking place? The cause of the expansion is the growth of the gamma 1 crystals, which is occurring in the matrix of mercury. Okay, and it is also leading to the impingement, which leads to the expansion. Okay, so therefore if during the manipulation, if there is less mercury in the mix, what will happen? It will favor the contraction of the dental amalgam. Effect of moisture contamination or delayed expansion. This is very important short note. It is often asked in the viva and framed as multiple choice question also. So let us understand this. Okay, now if the zinc containing low or the high copper amalgam, it is contaminated by the moisture, water, okay, during trituration or condensation, what will happen? It will lead to a huge expansion, which is called as delayed expansion. Now why it is called as delayed? Because it starts after 3 to 5 days and it may continue for months. Okay, now talking about its values, it may reach the values which is greater than 400 micrometer, that is around 4%. Okay, now what is the cause of this expansion? Why this is occurring? The contamination with the water during the trituration or the condensation, what happens? A electrolytic reaction takes place between zinc and water and it leads to the formation of hydrogen gas. This hydrogen gas, it does not combine with the amalgam. So what will happen? It will collect in the restoration and it will create extreme internal pressure. Okay, and expansion of the mass. It will lead to protrusion of the restoration out of the cavity. Okay, now what are the consequences of this delayed expansion? First of all, it will lead to the protrusion of the restoration. It will lead to increased creep, increased micro leakage, pitted surface, and the corrosion. Now, this all leads to the dental pain or reoccurrence of the caries. The next property is the strength, very important. This is the primary requisite for any restorative material, that it should have high strength to resist fracture. And if we talk about dental amalgam, it has sufficient compressive strength to withstand the normal masticatory forces, but it cannot withstand high tensile or the bending stresses. Okay, that leads to the fracture if there is improperly designed restorations. Now, fracture at the margins, if it is occurring, it leads to increased risk of corrosion, secondary caries, or subsequent failure. Now we have seen that fracture of the amalgam restoration, if we talk about the bulk, it is rare, okay, because it has good compressive strength. Mainly the fracture occurs at the marginal. Factors affecting the strength. There are different factors. First is the trituration. What is the effect of trituration? Either it is a under trituration or over trituration. It will always decrease the strength for all the types of amalgam. Let it be a low copper or a high copper. Coming to the mercury content, mercury percentage. If there is insufficient mercury, what will happen? It will lead to a dry and granular mix. And then it will lead to rough and pitted restoration. It may lead to corrosion also. And if there is excessive mercury, again there will be a reduction of the strength because more gamma 2 phase will be formed. Third is the condensation. Condensation is more important with the lathe cut alloys. A high condensation pressure is required for the lathe cut alloys. Okay, it is not much problem with the spherical, because the spherical amalgams, they are condensed with a lighter pressure and that produces adequate strength. Okay, along with a good condensation technique is needed so that the porosity is minimum and excessive mercury can also be removed. Next is the porosity. Porosity are the voids that reduces the strength. Again, it is a problem more with the irregular shaped particles or the lathe cut alloys. Okay, the voids is not a much problem for the spherical alloys. Next is the hardening rate. Effect of hardening rate is very important because the amalgam, they do not get the strength rapidly or instantly. After 20 minutes, only 6% of the strength is achieved. Okay, so that is why we ask the patient that not to bite hard, anything hard for at least 8 hours, because that much time is required to get 70% of its strength. The next very important property is creep. What is creep? The definition is very important. It is often asked in the viva and a short note is also framed on this topic. Okay, so creep is a time dependent plastic deformation of a material under a static load or a constant stress. Okay, so that is the creep. In short, it is a time dependent plastic deformation. Okay, higher the creep, higher will be the marginal breakdown. According to the ADS specification, the creep should be below 3%. Okay, that is very, very important. Now, coming to the creep values of different type of amalgam, in the low copper alloys, the creep varies from 0.8 to 8%. That is huge. Okay, high copper, it may vary from 0.05 to 0.5%. Amongst all the single composition high copper, they have the least or very low creep, that is around 0.05 to 0.09%. Why this is so? Why the single composition have the least creep? Because first, they do not have the gamma 2 phase, that is the weakest phase of amalgam. And second, the eta phase, eta rods which are formed, they help in interlocking of the network. This prevents the creep. The second factor is the zinc content. Okay, more the zinc content, less will be the creep. Okay, one more thing, if the all factors that increase the strength will decrease the creep value. Now let us just quickly summarize the compressive strength and the creep of all the types of amalgam. In the low copper amalgam, the first hour compressive strength is around 145, which reaches to 343 megapascals. That is a 1 week compressive strength. The creep is around 2%. Now coming to the high copper admix, it is 137 the first hour, which reaches 431 in 7 days. The creep is around 0.4%, okay, which is much less as compared to the low copper. Coming to the single composition high copper, it is 262 initially, which reaches to 510. That is the maximum compressive strength among all the types of amalgam. Okay, and the creep is quite low, that is around 0.13%. Okay. The next property is corrosion, very important. What is corrosion? Corrosion is a progressive destruction. Okay, it is irreversible of the metal by chemical or electrochemical reaction with its environment. What will happen if there is excessive corrosion? It can lead to increased porosity of the material, voids will result, it will reduce marginal integrity, then there will be loss of strength of the material, release of metallic products. Some byproducts are released in these chemical reactions. Then the factors which are related to tarnish and corrosion. Controlling these factors can only help. Okay, in the case of amalgam, first is the high residual mercury. If there is more mercury, more corrosion will be there. Second is the surface texture. More voids, more scratches, rough texture, more prone to corrosion. Then type of the alloy, very important. You know, the low copper alloy, they are more susceptible to corrosion because of the greater gamma 2 content as we saw in the setting reaction. Okay, then contact of dissimilar metals. For example, gold and amalgam. That also is prone to the galvanic corrosion. Then contact of dissimilar metals, even the mixing of the dissimilar alloys, that can also lead to more corrosion. In this case, the high copper amalgam, it acts as a cathode in respect to the low copper. Okay, then moisture contamination during the condensation, that also leads to corrosion. Clinical performance of the amalgam restorations. You know, besides this corrosion, amalgam, it acts as a self-sealing restoration because of this process of corrosion. How? As the age of the restoration it increases, the corrosion byproducts, you know, mainly the black silver sulfide, it accumulates at the tooth restoration interface and it leads to the progressive reduction in the marginal leakage. Now we will see that the margins of the dental amalgam, they may look broken down, but actually they have well sealed just below the surface. So it is a self-sealing restoration. It is often asked in the Viva also. Now to how to reduce this marginal leakage. We can use cavity varnish to reduce the leakage around the new restoration. And how we can reduce the corrosion in the amalgam. First of all, smoothing and polishing of the restoration. The texture should be very smooth. Then correct mercury alloy ratio and proper manipulation of the material. Then avoid dissimilar metals. Okay, like dissimilar alloys or even the mixing of the high and the low copper amalgam will reduce the corrosion. Next, if we talk about the susceptibility of different types of amalgam to corrosion, the low copper, they are more susceptible to corrosion. Why? Because of the increased gamma 2 content. Okay, and there is decrease eta phase. You know, eta phase is highly susceptible to corrosion. Okay, opposite, if we talk about the high copper, they are less susceptible. Why? Because there is no gamma 2 phase and there is increased eta phase, that is copper tin phase, which is less susceptible to corrosion. The three important factors that affect the survival of the amalgam restorations are: first is the material itself, the composition of the material, which type of amalgam we are using. Second, the operator variables, that is the manipulation of the amalgam is very important. And third is the patient's oral environment. So if we just summarize, in dental amalgam, we have discussed the composition, the various classifications, setting reactions of different type of amalgam and the different properties of dental amalgam. As this topic is long, so in the next video, I will be covering the manipulation of dental amalgam and the recent advances. Do not forget to share and like the video, my dear students. You can also give your topics in the comment section. I will try to cover them in my next video. Wish you success today and always.